going to show you the role of a veterinary technician during a spay procedure. So today we have Sally, a 10-month-old, 25-pound beagle mix, presenting for a spay. And all her physical exam parameters were normal, so we can proceed with the procedure. And since it's an anesthetic procedure, we have to calculate our anesthetic protocol, which I've done here. So you can see Sally weighs 11.4 kgs, and then we've calculated out all our pre-meds that'll go IM. Acepromazine will have 0.06 mils, atropine 0.42 mils, buprenorphine 0.38 mils, and then for induction, IV of propofol, which is 4.5 mils, and then post-operatively we're going to give Onsior, and then our PRI for this procedure for our fluids is 114 mils per hour, and then our drip rate is going to be about 1 drop per every 3 seconds using a 10 drops per mil drip set. So we have that all ready to go. So we can actually give Sally her pre-meds to get her, because that go IM, so it'll take about 20 minutes for those to get to full effect. So we'll give it in the semitendinosus, semimembranosus muscles. And then we can put her away and let her sit and absorb the pre-meds, and then we can get our anesthesia machine set up. Okay, so we're going to set up our anesthesia machine, and we're using a rebreathing circuit because Sally is greater than 15 pounds or 7 kgs. So the first step to setting up our anesthesia machine is turning the oxygen on. So we have our oxygen tank, we're going to turn it on. We need to make sure that the PSI in the tank is greater than 500, which it is. It's about 900. A full tank would be 2200 PSI. And then we need to make sure our regulator is set correctly at around 50 PSI. Okay, so now we're at our anesthesia machine. We need to make sure that's all ready to go. So the first step is to check our flow meter. So we're going to turn this green knob up to 1.5 liters per minute. Make sure the knob turns smoothly. It stays at that 1.5 liters per minute. And then when we turn it off, it goes back down to 0, nice and easy. The next part is to check our vaporizer. We need to make sure that is full or has appropriate level of anesthetic in it, and that it's also nice and tight and all together. Then we're going to go to our rebreathing bag, and so we need to calculate the correct size. So for Sally, we're going to use about a 1 liter bag. The next step is our breathing tubes. So we have a Y-piece tube on here. We could use an F tube as well. And so then those are all hitched up to the correct inlet and outlets. And then next we're going to check our CO2 absorber. We're going to make sure that it's not expired. The granules would be purple, and they would also not crush very well. So we can take some granules out and crush them, and that will show that it's all ready to go. The next thing we would do would be weigh our air canister. Once that's gained 50 grams, it's expired, so we'll have to make sure that that's at the appropriate level as well. And then once that's all done, checking out everything's all put together properly, we can do our leak test. So how we do that is we're going to close our pop-off valve, and then we're going to occlude the patient end of our Y piece here, and then use the oxygen flush valve to flood the system with oxygen until the pressure manometer, which is this little thing, reads 30 centimeters of water. Then the pressure should not decrease more than 10 centimeters of water within 30 seconds. So just watch that pressure manometer for 30 seconds and make sure it's staying steady and not excessively decreasing. And then we can open up our pop-off valve. The gas will go to the F air canister. And then our next step is to do the scavenger system test. So how we do that is that we have our pop-off valve open, and then we're going to occlude the patient Y piece again. And then we're just going to turn on the flow meter to about 4 liters per minute. And then just making sure that that is staying steady, that the pressure manometer is not increasing by more than 2 centimeters of water, to making sure that the scavenger system is working appropriately. And then once that's done, we can turn our flow meter off, and we should be all set to go with our anesthesia machine. Okay, and then as a veterinary technician, I need to make sure everything else is set up as well. So we can have the surgery table all set up with the warming device on. Even get excess warming devices like a bear hugger if needed. You can also have table ties ready to go, a V-trough. Make sure your lights are all set up and on. You can even have an ECG, capnograph, Doppler to measure blood pressure, IV fluid pumps ready to go. And then for my surgeon and myself, if I'm scrubbing in, then we'd need a scrub cap and mask, a gown pack, scrub, the stuff to scrub like Chlorhex or whichever you're using, sterile gloves of the right size, and then drapes, your spay pack, your appropriate scalpel blades, so probably a number 10, and then the surgeon's preference of suture. Okay, so now that Sally's all pre-medded, we can give her her IV catheter now. And we place an IV catheter so that we can give the induction drugs appropriately, and so that we have IV access in case of an emergency, and then also to give fluids. So we're going to do a lateral saphenous catheter on Sally today. So we're going to need our clippers with a 40 blade, so we can clip a little spot. And then since it's a catheter, it has to be sterile prep, so you want to do our scrub and then our alcohol and do that 3 times, okay? And then now we can ready to place our catheter. So typically it has someone holding off up here, so that vein would pop right out. And then we can take our catheter. Make sure it slides off nice and easily, ready to go. And our cap is all ready to go. Okay. So we'd see that vein pop up, and since the saphenous moves around a lot, we want to do a nice swift quick poke. So poke. Once we get blood in our hub here, we're going to advance the catheter and then pull out the stylet once the catheter is all the way in. And then we can apply our cap. And then we can flush it. Make sure that it's in correctly, everything's going nice and smooth. And then we can tape it in. Okay, and that's how you do an IV catheter in the saphenous vein. And then for Sally, we're going to use a 20 gauge 1-inch over the needle catheter. Okay, so next step is to administer our induction drug, which is propofol. So we can give that IV through our catheter that we just put in. And we're going to do it slowly so we can give it to effect. Sometimes you can just give half, see how they do, and then add more if needed. So that's how we would do that.